Hello and welcome. I want to start out by thanking Oracle for the opportunity to share the story about how we assisted a client respond to COVID-19. It's a healthcare provider because of the analytic solutions we had helped them develop. My name is Dan Kinsella. I'm a managing director in the analytics and cognitive practice of Deloitt Consulting. I focus on the provider industry and more specifically, the provider subsector. I also want to thank my colleagues from Deloitt, particularly those in the Oracle analytics practice that helped both with the content that I'm going to share with you today, but more importantly, heroically delivering the solution to our client. One of my favorite quotes is that all of us are smarter than any of us. And in this situation, it was incredibly applicable. What we needed to understand from a wide array of client end users contributing and the solution architects that we had to put together to do something rapidly really required the mind meld of a lot of people with different backgrounds. So relative to COVID-19, you can't pick up a newspaper or look at the news these days without seeing how it's impacted everyone's life. And in particular, it was relevant to the providers, doctors, hospitals, caregivers who were literally at the tip of the spear, trying to figure out what was going on, figuring out how to respond, and figure out how to take care of patients, which is their core business. Part of the reason I've always stayed in the healthcare sector in my entire career has been the ability to try to make a difference. Even prior to COVID, provider organizations have struggled with analytics. 10 years ago, I used to talk to CIOs and they'd ask about what kind of estimate they had to put in their 3-year plan for a data warehouse or business intelligence solution. Really, the last 10 years, that was all set aside as they focused on installing enterprise class electronic medical record systems. Even today, we've got a big surge in interest in ERP systems. A lot of those, they've not been touched in a lot of places since Y2K. Sandwiched in between those milestones has been quite an array, quite a level of activity around mergers and acquisitions, trying to get to scale and relevance for payer contracting and the transition to value-based care. Providers have been acquiring physician practices and other hospitals, contributing to this challenge of having a solid analytics platform. In lieu of actually working with a client to help them develop an analytics strategy, I like to use the Deloitte's insight-driven organization framework as a proxy. Everybody wants to become more insight-driven in their operations, in their decision-making. And it was part of that IDO framework that helped this client prepare for what they could not have anticipated with the COVID-19 pandemic. So let me give you a little bit of an overview of the solution that we helped them develop, the goals of the solution, our approach, and really the outcomes. This was a day-to-day, hour-to-hour, multiple huddles every day to try to figure out what's going on, what do we have, what do we need. So planning, analysis, and a response management. This client set up a command center, which was pretty common across the nation to try to do this. We try to create integrated dashboards for transparency. And what I always like to talk about is actionable insight. So not just look at something that was 6 months in arrears. We're getting day-to-day urgent requests from key leaders trying to do their piece of it. Fortunately, part of what we had in place with the work we've been doing was a hybrid agile approach to development. So we were able to quickly pivot our resources who had been involved in developing some of the things I'm going to share with you to the COVID agenda. And the approach involved visualizations across the 3 main pillars of ERP, if you will: finance, HR, and supply chain. I'm going to take a little bit deeper dive into those. So let me share with you a little bit about the solution that we helped develop and how the architecture of that solution really helped us to respond rapidly, which was what was required in the case of COVID. This is all based on Oracle Analytics Cloud. A little bit of the history on that with this account. When we started working with them 3 years ago, they are PeopleSoft on-prem, they had OBA licenses kind of on the shelf. We developed initially with HR analytics, and over the course of the last 2 years, moved to the cloud for a number of good reasons, including efficiency and licensing cost distribution. So we do have the visualizations in the cloud. We're giving you some sample of some of the KPIs from the left to right: finance in green, HR in the pink in the middle, and supply chain on the right. We did provide a little bit, so the gross anatomy of the OAC platform here from top to bottom. So from dashboards to KPIs to the data warehouse to source systems. I mentioned our first phase, we really were initially restricted by scope design to data that came out of PeopleSoft. We have since enabled the ability to ingest sources of data. Things like crosswalks between systems is a good use of that. PeopleSoft that came from the factory integrated with the OBIA platform. Kronos, the time and attendance system used by this provider, was also very important to the use case for HR. They were trying to get a proactive edge on nurses that would be available to staff ICU units from across the health system. So Kronos gave us a 6-week forward-looking schedule as to who was available. Epic is the electronic medical record system. We curate data from Epic into the Oracle Data Warehouse. Milliman for claims data, so for the value-based care contracting and employee benefit cost analysis. Press-Ganey, important for us to understand employee engagement, which is a key factor in the overall quality program. And EPSI, which is the cost system. So with the infrastructure that we had already established with our year and a half of working with this client prior to COVID, we had an industrial strength system that was able to rapidly add what we needed based on the use cases. The client team was able to curate the Kronos data, for example, in a matter of a week from 2 different versions of Kronos. They're migrating to the new Dimensions product, which is in the cloud, and they had a handful of their organizations on the legacy as well. But some of the KPIs, finance was looking at how much they were spending on COVID. The key function for HR was on this staff scheduling for the central staffing office, and then obviously with supply chain, availability of PPEs and key supplies to make sure that we were ready for what was to come with COVID. Fortunately, the COVID situation has seemed to taper off. I think in the case of our client, the area around them has moved the curve, and they're now talking about how to get back to some version of a new normal. So how did we get there with them? I mentioned the IDO framework early on. And when I first showed this to folks, it does look like there should be a number of game board pieces and at least a set of dice, but it is not a board game. There's no one way to move. It's also not a methodology. You don't have to check the box in every cell. I like to think of it as an artist palette. We want to work with our clients to meet them where they are. And so it really does depend on where you are with each client. With this client, for example, our first project with them was on metadata management, mastering provider information, because they had a quality problem with reporting provider information. They'd grown rapidly by acquisition and multiple sources that hadn't been sorted out about provider. So we started with MDM for Provider Master, and we're working on the first phase of operational analytics with HR, when one of the leaders said, this is great, Dan. I can see how we're doing this, but how do we make sure we don't cross over into each other's swim lanes with all these different projects? So working with the CIO, we crafted a flight plan to work on this. But a little more on the methodology. I like to also say that solutions that come in either one end of the continuum or the other, so all strategic without any in technology rigor, They might work on the whiteboard or the PowerPoint platform, but they're not going to be sustainable. And they certainly aren't going to be able to pivot when the game changes quickly. Conversely, you might have, world-class, heavy iron on the technology side, but if it doesn't mesh with the enterprise strategy, it also won't work. So a couple of highlights here. On the strategy dimension, one of the key things is to settle on the operating model. And again, it's not one size fits all. To what extent are some of the analytics functions centralized versus federated? Most in the provider sector are probably some variation on that, a hybrid, if you will. But that's important. What things are centralized versus what's federated? The analytics vision needs to align with what the enterprise is doing. Are they growing by acquisition? Are they a large academic medical center? Are they into research? Those are some of the things that work. On the people dimension, I'll just talk a little bit about talent, because we had such fun with it, talking about the notion of purple people. So purple, we think about people who know the technology is red, it happens to match with Oracle, and people who know the business as blue. And so the combination of red and blue is purple. And it stuck to the point where executives there today still talk about purple people. And it's like, where are those people that exist in the organization? And how do we share them? How do we develop more of them? And then how do we retain them? So certainly talent is a big part of anybody's people strategy related to analytics. From a process perspective, we found a big aha with this client was that intake and governance, because they'd grown so rapidly, customers were confused about how to get stuff done. So ideation and prioritization and governance, whether that was IT, optimizing a product so you can capture the data, or analytics specifically. So I had mentioned the data dimension, and in terms of master data management, one other thing I'd point out in terms of the IDO framework is to consider ethics and sharing policy. You got to get involved with your compliance and your legal team about who you will share data with and under what conditions. Are you willing to monetize your data to some of the offers coming from some of the pharma companies in pooling your data? And under what conditions do you identify clearly as a capability that's needed? On the technology dimension, everybody wants to talk about technology when we talk about analytics. And certainly you can't get far without it. Pardon me. The one thing I would point to is the reference architecture that we developed, which is a way to identify how you can use what you have, buy what you need, and then build what you must. In the case of the provider reference architecture, it's important to consider what capabilities come out of the box and need to be fully exploited from your EMR vendor, in this case Epic, or from your ERP vendor, in this case it was PeopleSoft, or from the cost accounting system or your research function. And what do you need in the middle? So reference architecture was also a big part of what we did. Voice of the customer. At the beginning of the flight plan, when we started to do the assessment with this organization, we used this diagram to assess voice of the customer. And if you, without squinting too hard, that circle on the right of your screen is divided into 4 quadrants: market, clinical, operational, and financial. And it's important to consider all of those. And I remember sharing the observation as we were doing the interviews. It was kind of like strolling around the farmer's market in the town square as to who had fresh analytic insight, who was making it, how long it had been around, and who was buying it, because it was very inconsistent and required a lot of individuals going out to find the data, find it, mind it, grind it, and bring it back, create the report, which was stale the day it was printed. And so this is important in terms of the use cases. One example I like to point out is that, leaders of clinical operations, let's say Heart and Vascular Institute, also have employees. So they're interested in vacancy rates and turnover. They also have supply needs. So it's not, clinical dashboards alone don't cut it. We really need to provide an enterprise view of the solution. And this framework was helpful during the flight plan. So part of the reason I came to Deloitte Consulting after many years of experience, including having been a CIO, was the amazing set of capabilities that Deloitte has. I am part of the analytics and cognitive practice, and I have colleagues who are at the forefront of new science, including robotics and digital FTEs that are now part of our resource portfolio. But we do things like data and analytics, modernization, robotics, cognitive insights, and managed analytics. We can do things for advising, like the flight plan implementation, and operate from resource centers all around the world. And one of the keys to our success, and the analysts certainly are recognizing us, as you can see from the bottom right, is our alliance programs. And highlighted here, especially today, is the Oracle Alliance. So that concludes my storytelling for today. I hope you got something out of it and enjoyed it. I'm very pleased to continue and answer questions that you've got today.